Hello and welcome to Dojo Live this February 28th, 2023. My name is Kim Lantis and it's my pleasure to be hosting along with America Guerrero today.
Hello, everybody. Hey, Seth.
Hey, good to be with y'all.
Yes. And of course, the guest of honor, the most important person of today's show is Seth Rainford, who is you've got a lot of titles here, Seth. You are a busy guy, president, COO, and co-founder of Digital Diagnostics. Thank you for joining us.
Thank you for having me. And despite the words, my job function is actually to just find how I can help everybody else around me and do what they tell me to do. So don't let that fool you.
Like the master helper.
Yeah.
Perfect. So Seth, this is awesome. I love the humility in your title. We'd like to get to know you a bit more before we kind of kick off in today's topic. What's your story? What's your passion and what's led up to your time with Digital Diagnostics?
Yeah, well, so my story starts in Indiana, which is where I was born and raised. I grew up in a rural part of Indiana before we moved into Purdue country. If anyone familiar with West Lafayette is where I grew up after that. So we didn't have a lot growing up, which plays a little bit into my story, I suppose, as to why I came to where I am now. But I won't skip ahead. After Indiana, undergrad in particular, I then moved to Chicago, where I spent about 15 years. My first role there was sort of building a business within a business in healthcare, more on the provider side, doctors for our non-healthcare audience, more with a physician group, healthcare, hospital type setting. And then I grew a little weary of academia, moved over to the publicly traded side at LabCorp Diagnostics, which some of the audience may have heard of more recently during the pandemic and all the testing that we were doing. So at LabCorp, I ran the Midwest P&L. So both sales and operations, did a lot there. That was as much a turnaround situation as it was building. So near the end of my tenure there, I started doing some free advising for private equity, venture capital, just to learn a little bit about that world. And that's what landed me initially in an advising role with this company, and then months later joined as an operator at Digital Diagnostics. So that's obviously where I am today.
Cool. So let's talk about Digital Diagnostics. Who are you and what's the problem that you're solving?
Yeah, well, we're an awesome tech company to start with. And I would say we are a tech company with a really cool mission. So our physician founder would oftentimes talk about, and still does, what is known as glamour AI. When tech companies build something that's cool, specifically maybe AI, but what is its real world application? How does it really meaningfully impact patients? So I suppose I make that distinction because for us, we're on a mission to impact patients in a really positive way. And we really want to impact patients with accessibility. So again, for folks maybe who don't live in healthcare every day, how are we making sure that patients like me, when I was growing up, who didn't maybe necessarily have immediate access to healthcare, how can we impact that in a positive way? Democratize access for those folks to be able to get treated, get diagnosed, get interventions if they need it. So accessibility. Affordability, which I also mentioned a little bit in my background. So, there's both the cost to a patient, maybe someone like me who's growing up without a whole lot of financial resources, being able to provide something that is affordable for that patient. The other thing I would mention there is you all have probably heard about the healthcare cost issue we have as a country, right?
Oh, yeah.
So, there's that aspect too, which is can we both do something that's good for patients and more affordable for patients, but also as a net positive for our health system and affordability overall. So accessibility, affordability, equity, which is something that has especially been something we've talked about more in earnest since some of the pandemic and understanding that we do have different folks that are at a disadvantage with respect to accessing and getting the healthcare that they need and deserve. And then finally, quality, right? We don't want to do all of this in a way that is not at a very high bar, very high level of quality. it's cool if we can do those first three things I mentioned, but you don't want to do those at the risk of compromising quality. So that's maybe the fourth part of our mission. So all of that to say, cool tech company on a mission.
I love it. And I think that brings us into today's topic, actually, and how you're going about doing that is with artificial intelligence. So what is today's topic, America?
Yay!
As chosen by Seth.
Yeah, today we're going to talk about using tech to drive meaningful change in healthcare. How is artificial intelligence improving patient outcomes in healthcare systems and beyond? So please share with us the answer.
Well, so I mentioned our mission, right? And I mentioned also Glamour AI. So what our company does is in the middle of 2018, the FDA cleared for the first time in any part of healthcare's history an AI or computer to fully replace the physician in that medical decision, right? So oftentimes when we start with what is our company, you hear about AI all the time in healthcare, but 98% of it is what we would refer to as assistive AI, meaning the AI could be doing some good and could be helping, but ultimately it's leading to a provider or a caregiver looking at the information and then saying, well, I agree with this, I don't agree with this, and maybe it makes that person a little bit more efficient. Hopefully it helps with quality that I mentioned. But at the end of the day, when we're looking at transforming healthcare in a positive way for patients, we thought that doing something autonomously, where the computer itself was doing all of that, and in our case, triaging patients who actually needed an intervention versus those patients who actually everything is okay, but they were just waiting in line or waiting for an appointment to get that diagnosis, is really a way that we can have a pretty big impact. So that FDA cleared product that I mentioned was for diabetic retinopathy and macular edema. And what that means is patients that have diabetes, generally speaking, will go to their primary care doc, but lots of the time, maybe 3/4 of the time, they won't go on to the next visit with an eye care specialist to have their eyes checked out to make sure they're not going blind as a consequence of having diabetes. So the thesis or the idea with our technology is if you build an AI that you can move to that first visit in primary care, or these days I like to say frontline care, because patients are accessing that first line of defense in a number
with Google.
Exactly. So if you can move that testing to that first frontline visit, then your compliance for those patients getting checked goes way up. And then we start to do some of the things that I referred to earlier, right? Democratize access to this kind of care, help identify which patients really need an intervention and have to go see a specialist so that they can get treated, those kinds of things. So we have, and I probably will get into this a little bit more, but we have been trying to figure out where our technology really belongs in the healthcare ecosystem. And I'd like to think for the last 3 or 4 years, we've kind of nailed that down and we're in a good place now. And so we're now in the process of deploying our technology where it can really make a big difference.
Wow. And I mean, what you've alluded to at the beginning, and I think we talked about a bit pre-show when I was checking out digital diagnostics, where it can make the biggest difference. The first thing that actually did come to my mind was rural America, right? Those folks that are that have to drive hours to get to a specialist or something. And then you've got the cost, like you're saying. And there's just, I think, this cultural tendency to be like, it'll be fine. It can wait. And then really, as I used to say, even my mom grew up, in North Dakota. I'm from Montana. My dad's from there too. So I get it. This sort of like doctor aversion that we have, like, unless we're dying, we don't need the doctor. And then unfortunately, and sometimes that's the case. By the time you go, it's too late. So with rural America, how are you deploying this, or how are you seeing this work?
So I love what you say, because it's so true. And just as a parenthetically, before I actually directly answer your question, this disease in particular that we started with is exactly what you say. Patients are generally asymptomatic, meaning they can't tell that something is going wrong until it's too late, right? So then because
I think with your vision, it just gets worse over time and you don't notice it. Right?
That's right. And then when they do, it's too late. And we could have had a pretty non-invasive intervention, something like eye drops, that could have completely helped that patient if they had just known, right? So you're hitting the nail on the head. To speak directly to sort of how are we deploying it, especially in rural areas, we have really found, I mentioned before, we've been focused a lot on how do we make this really smooth and seamless in the healthcare ecosystem today. And so we've seen a lot of traction with health systems in particular. OSF is a health system that we recently had some nice press around. It's sort of in the Midwest in a couple different states. And Parkview is another one. Community Health Systems is another one. These different health systems, so think of hospitals, primary care groups, medical groups who are looking to deploy our technology and deploy it at scale, are really starting to reap some of the rewards of making that decision. Meaning a lot of these health systems, as you can imagine, have a number of competing priorities that they're trying to figure out how to solve. And what's been fun and really rewarding is those that have looked across their priorities and seen the diabetic eye exam, for example, which is oftentimes a really hard care gap for them to narrow down and to close. Those that have deployed us at scale and made the diabetic eye exam a higher priority are now starting to see an impact to health equity, an impact in economics, an impact in some of the quality incentives that they're trying to strive towards. They're starting to see a solid ROI, both with the end clinical results with their patient population, as well as the financial results. And it's just been, those have been some of the areas. I guess I should probably also mention some of the non-health system partners as well. Ocean is another interesting partner that we've started deploying with more recently. Bellin is another health system that I didn't mention, also sort of in the Midwest. And Cano Health, which has been in the news as recently as today, is another really cool value-based care partner that sort of understands the benefits of looking at our technology, prioritizing it, and we're already starting to see some of the great things that have come out of that. So we're deploying in a couple different sectors, as you can hear there, and many of those have pretty strong footprints in rural America, as you alluded to. And so a great opportunity for us for, if you think about our technology, you can plug it in and have access to high quality specialist level care, which is pretty amazing in the context of how we have traditionally thought about bringing up care providers, especially in this country. Now, anywhere you have an outlet, you can plug something in and start doing testing, which is just really, really cool to see.
An outlet and kind of with anyone. Sorry, America, I was just curious of what type of individuals are using your machines.
I'm so glad that you asked this. So when we designed our technology, it was important for us to make it so that anybody really could use it. We did our clinical trial with high school educated operators, meaning if you thought about building something and having to have this very difficult or high level certification, you could start to understand that the access argument that I just made becomes harder, right? Because you can plug it in, but then if you have to do a bunch of training and continual hand-holding with those folks to do the testing, that sort of defeats the purpose a little bit. So we did our clinical trial with folks that just had a high school education. They didn't have any previous eye care experience. And so if you can think about a tablet and just pushing buttons on a tablet and the system sort of doing the rest, and in just a few minutes, you have a point of care result that you're then having a conversation back and forth with the patient saying, hey, this isn't something you're hearing about 2 or 3 days later. Right here, as we're sitting face to face, you're losing your eyesight. We got to figure this out. We got to get you to somebody that can help. You can start to understand the impact of that and the importance of making sure anybody really can operate the system, if that helps.
Wow. What about the Derm Spot product that I see on your website? For example, that one I saw a photo with someone using it, and you're talking about accessibility. So anyone could have that product in their cell phones, or does it necessarily you need to be a medical doctor, or you need to be someone to be trained, or maybe me have it here, or what? For example, in this specific product, how does it work?
Yes, thank you so much for asking. You give me the great opportunity to talk a little bit about where are we going, right? So we have this FDA cleared, amazing product that helps save sight, but we're in an age where everyone is very, very busy. And as I alluded to, focused on just a few priorities at a time, we are building a platform of diagnostics. so that ultimately patients can access, but providers can then allow those patients in their care setting to access these diagnostics in a much more broad way, right? So think of things like skin cancer that you alluded to, cardiovascular disease, neurological disease. There really are dozens, if not hundreds, of different tests that we can unlock access to on this platform over time. And to answer your question specifically around derm spot, it's been important for us. Well, you might imagine physicians' initial reactions back years ago was, oh my gosh, is this revenge of the machines? You know, what is coming now with this AI that we're hearing, may take our jobs. This, in fact, not been the case at all, right? Physicians are some of our biggest supporters because we are allowing those physicians to do top of license work. And some of the more routine diagnostics is sort of our sweet spot and where we're really adding a lot of value. But the reason I mentioned that in answer to your question, America, is that we are very serious about keeping that testing in a medical home. And so whereas one day I think we may be ready for a consumer to pick up an iPhone, take a picture, and then have a result pretty fast, we're not quite there yet. We're working to keep things like derm spot in the medical home so that for those patients, God forbid, they do have a positive result, they can immediately have a conversation with that provider rather than maybe being in their own home, getting a positive to something like a melanoma and saying, gosh, what do I do with this? Is this real? Is it fake?
Don't freak out.
So definitely something I think for the future, but for right now, derm spot as well as our other testing will belong sort of in that frontline care health systems that I alluded to, at least for the foreseeable near future.
I think that makes a lot of sense. In terms of the AI here, you talked about this a bit. We started, your specialty right now is with the vision scans, skin's coming up next. You alluded to cardiovascular. What motivated this choice of where to start for digital diagnostics? Was this just what AI was capable of? Was this just a big gap in the market where you found there to be the most need, a mix of the two? What determines your path?
That is a very great question. And you actually sort of answered it in your question. High fidelity data, right? So where does a data set exist that we know if we look at changes over time, we can tell with certainty what the diagnosis or the outcome might be? So high fidelity data, what really drives patient outcome, right? So if I could test for something that we didn't necessarily have a therapeutic or some sort of intervention, a way to help the patient, it would be good to know, obviously, that a patient was dealing with something, but we wanted something where if you catch it, and especially if you catch it early, you can dramatically change that patient's outcome. And it's not only for the patient, but there are pretty significant downstream consequences from a financial standpoint. Depending on what data you look at, $20,000 to up to $100,000 a year is what it costs after a patient goes blind just to care for that patient. So being able to catch that early not only is the right thing to do, but it's also really good from an economic standpoint, both for that family in particular, as well as I mentioned earlier, the health
entire system.
overall.
For sure. So now I got all distracted by your cool comment that I forgot my question. Okay, I do remember it now. What comes up a lot of the times with AI is this idea of garbage in, garbage out, and how we can keep this equitable, right? In which you brought up equity a lot. Even today, seatbelt designs are usually for adult men, right? That's so children, everybody, we have to adjust in order to make seatbelts safe for them, et cetera, et cetera. So how are we making sure that your AI is doing right by everyone?
Well, as you probably can imagine, I love that question too, given what I said earlier. First of all, we started the process with the FDA in 2010. And if you can imagine a computer making a decision instead of a human being and all the things that go into the ethics around that, you can probably appreciate that while this has been a topic that we're talking about a lot more recently, we had to start over a decade ago if we wanted to build, our tagline is AI the right way. And so if we wanted to build AI the right way, we had to start with a foundation of an ethical framework that could help us do that. And so how did we do it? Well, number one, we made sure that the data set that we had was unbiased. It had good representation. It wasn't just from one city or one specific academic center, for example. We did it in primary care clinics that had a very mixed population of race, ethnicity, gender, et cetera. So you've got to start with the right data is the first answer to your question. Second, from a business model standpoint, this would be something that was compelling to, for example, those academic centers that I mentioned, but it's more compelling if you can make it economically viable for anybody that wants to use it, right? So rather than very high cost of capital to get in, we've changed our business model to be such that it's a very simple subscription. We provide all of the equipment and the training, et cetera, and it makes equitable access for patients, of course, but also the providers that are using it pretty reasonable. And that's not usually a barrier to entry or a discussion we even need to have. Finally, if we go back to design for a minute, when we were working with FDA, it was important to us, especially in the context of AI, to have something that was biomarker driven, meaning we weren't using just pixelations that perhaps different pigmented skin would yield different results. So we built an AI that was invariant to race, ethnicity, and gender. And everything that our AI is doing is traceable and transparent. So it's not this black box where you mentioned garbage in, garbage out, where data goes in, you don't exactly know what the AI is doing, and then you have this result at the end that you may or may not trust. Ours is actually, our algorithm is fixed. And if we change it, then we have to go back and make sure the FDA knows that we have changed it, we've improved it, for example. So it's not like it's continuously learning in the meantime and, oh no, we don't know if it's become something that's causing patients harm. In fact, we have something that we built from the ground up with an ethical framework to be mindful of different immutable characteristics so that we can have something that's good for everyone and something that we were excited to take to the market that would, again, be biomarker driven and invariant to all of those things that we talked about. So health equity, a big deal for us. And we're, as I mentioned earlier, if you think about the concept of going into a healthcare desert and plugging in access to something that otherwise would not have been available, that access is a really, really exciting thing for us and missional for us a number of different ways.
For sure.
What are your plans of providing these subscriptions outside of the United States? Because as you said, you need to recollect a lot of data from the population, from everything, right?
Yes.
Is that in your plans?
It is in our plans. And I'll say a couple of things there. So if you have tracked the company at all, we recently did an announcement in the Middle East where, believe it or not, the prevalence of diabetes in the Middle East is twice that in the United States, which is an area where we can obviously make a very good impact. I would also say we are still a growing company, and so it is in my heart's desire. I've had the great opportunity to do missional work in my background to take this to other underserved countries that really, really need it. And so we are hyper-focused on growing the business in a really sustainable way so that we can continue to get this to those folks that really, really need it and maybe perhaps can't pay as much as some of the other more developed countries can right now. So yes, on the roadmap, and obviously trying to get to a point with the company where we can really focus on that in earnest, but not quite there just yet. So doing both, but there's a little bit of a staged approach to get there, if that makes sense.
Mm-hmm. We're coming to the final few minutes, but I do have, before we get to your words of wisdom and kind of company culture, I have one more thing to ask, and that has to do with this rage of the machines, this acceptance of even just the physicians or the communities when we're talking about artificial intelligence. How have you seen this impact in terms of is or is not taking their jobs or allowing them just to do their jobs better? I mean, in my mind, it would be exciting to use something like this because I'm getting the patients and the people that I'd really like to treat kind of frontline and funneling in a heck of a lot faster for those kind of exciting, more challenging cases that I would be interested in. But how are you seeing this play out in the real world, and how do you go about kind of convincing people that AI is not the enemy?
A lot of education, as you alluded to. The first thought out of the gates is often, oh no, is this going to take away something that I'm currently doing, currently billing for? Does it make up some of the profit margin of my practice? But as I mentioned, it hasn't actually been that difficult. And when you have a conversation like this and talk a little bit about what we're trying to do, the narrow task that our AI is doing versus everything else that the providers are doing in that medical home for the patient, it's actually a pretty compelling case. And it allows physicians in particular to do what they went to school for, right? Which is practice at the top of their license, really treat and do an intervention with those patients that need it, and have something like an AI that can help more earlier upstream to diagnose those patients that ultimately need to be sitting in front of those physicians, instead of the patients that, we're worried about something, but ultimately we're in the 80 or 85% of patients that are completely fine, normal, negative. And the physicians then can spend more time improving patient lives, which is both good for them and also good for business, as I alluded to.
Yeah, I mean, I guess it's actually broadening that funnel, getting them individuals and patients from the more rural areas that they may not have seen or for, a long time.
You got it.
And for healthcare purposes, this reminds me of the show that we had. Kim, this is another topic. It was about aircraft, but we asked the guest if the population was ready for this kind of innovation. So the way that they are introducing this kind of technology is with ambulances. Is that the word in English, Kim?
Ambulance. Uh-huh.
Yeah, so it is for healthcare purposes, and the people will accept it. So with AI and with this focus, it's the people are ready.
Yeah, it's a space where I think we're more ready to have technology step in medical care on the whole. Perfect. So like I said, Seth, we're actually coming to the end of today's show. If you can believe it or not, these 30 minutes go by very quickly. We would love to just kind of ask you, and your, as a co-founder, as you've been doing this for many years, kind of your words of wisdom, words of advice that you might have as this, I really loved what you said at the beginning of the show. My job is just to help everyone else. But what types of words of wisdom might you have for, other leaders like yourself in terms of what to do and what not to do as you move forward in tech?
Sure. Yeah. So it's pretty simple. There are all kinds of problems to solve these days. And so often I feel like we can be distracted by what divides us or what maybe we don't agree on. But focusing on the mission, as I started with earlier, and focusing on what the reason we're all here, right? What unites us and the good that we can do for patients in our case, and the outcomes of those patients is a pretty worthwhile endeavor. We're pretty proud at Digital Diagnostics of what we call our core behaviors. So they are like values, but more actionable, if that makes sense. So there are things like assume positive intent, right? So when we're interacting with each other, let's start from a place of empathy, but let's also start from a place of assuming that the other party is super excited to do the right thing and do the right thing by patients. Going all in is this week's core behavior, as an example. So you can probably imagine what that entails with, hey, we're working hard together. We're fully committing to what we're doing. So I think those elements have also really helped define our culture. And there are, as I said, a lot of problems to solve and a lot of opportunity. So focusing on those things that bring us together and that we can march hard towards a really common good is, I think, maybe my words of wisdom and things that have worked well for us anyway.
Perfect. We've heard that assuming good intent before. I think it was with the show with Daniel Keevan of Paddle, but I really like it. Not only I think with the internal culture, but as you're pushing outward with your clients and expanding, and even as we get more and more global, right? And cross-cultural interactions where a lot of times it can be confusing and misunderstand one another, and always have that assuming the good intent, I think makes us better people, not just better, teammates and coworkers.
Well said.
Perfect. Well, thank you so much, Seth, for your time with us today here on Dojo Live. It was a pleasure to get to know you, to get to know Digital Diagnostics a lot better. Congratulations on what you're doing. It's got me super excited.
Thank you. It's fun to be with you. Thanks for everything you guys are doing to get the word out. And we'll look forward to continuing to follow all your great work.
Awesome. Well, thank you. We'll stick around just a minute as we go off air. But before we do, we'd like to introduce tomorrow's show.
Yay! Tomorrow we're going to have more information, more learning with Brandon Nefari. He's co-founder at the company Charge Fuse, and the topic is going to be about hyperscaling an IoT-based consumer tech company. With IoT and the intersection of both hardware and software, what does it take to scale this type of business nationally in a short time span? Tomorrow at 10 a.m. Pacific.
All about scaling. We love it. Yes. See you tomorrow, 10 a.m. Pacific. Thank you, Mirka. Thank you, Seth. Once again, have a great day, everyone.